Thank you, Ambassador Rice. And it is my great honor to welcome these extraordinary leaders for this conversation. You all have been on the ground doing the work of connecting with women around our country. You are national leaders. You are powerful leaders on an issue that still requires so much in terms of a priority by all people. Before we get started, I do want to address the killing of Daunte Wright. He should be alive today. And to his family and loved ones, you must know that the President and I grieve with you as the nation grieves his loss, and we stand with you. Our nation needs justice and healing, and law enforcement must be held to the highest standards of accountability. At the same time, we know that folks will keep dying if we don't fully address racial injustice and inequities in our country, from implicit bias to broken systems. Which brings me to the topic of this moment. This week is Black Maternal Health Week. And make no mistake, Black women in our country are facing a maternal health crisis. Black women are 2 to 3 times more likely to die in connection with childbirth than other women. And it is important to note that Native women are 2.3 times more likely to die from pregnancy-related causes than white women. We know the primary reasons why: systemic racial inequities and implicit bias. And the consequences are both very real. Many of the women in this room have experienced them firsthand, and as the ambassador said, we will hear their stories, which they speak with great courage, given the pain that they have experienced. And over the years, I've heard many stories of women who are experiencing postpartum depression only to be dismissed, stories of women telling their doctors they were experiencing pain only to be ignored, stories of women who could not hold their newborn baby because that child had to be on life support, or receive a blood transfusion after blood transfusion after blood transfusion. Black women deserve to be heard. Their voices deserve to be respected. And like all people, they must be treated with dignity. For years, I've been working to address systemic health disparities and advocating for investments in those social determinants that we know influence maternal health. Things like housing, transportation, nutrition, and the inequities that exist in all of those systems. When we talk about Black maternal health, we're talking about reproductive health care. Let's be clear about that. We're talking about reproductive health care. And another issue that I've spent a lot of time on that point, as it uniquely and disproportionately affects Black women, are fibroids, which can lead to maternal mortality, especially for Black women.